Again.
Thank you, Madam Chair. I want to build actually on what you were talking about because we are all worried about what did happen, et cetera, because during COVID, how we don't repeat it and how we make who stronger. When it comes to preventing and preparing for future pandemics, whether we like it or not, safeguarding global health and our own national security interests are inextricably linked with other countries around the world. That's when we live in this modern world. That's a reality. So under President Biden, the United States has reasserted its global health leadership by re-engaging with the WHO and proposing substantive reforms to promote transparency and strengthen the international community's position against countries that obfuscate and evade accountability. So let me start with you, Assistant Secretary Pace, and have you elaborate a little more. How has the Biden administration's re-engagement with the WHO helped to solidify America's global health leadership in the wake of COVID-19 pandemic? And what are you doing? You're not just talking, you're acting.
Absolutely, Madam Congresswoman. Thank you for that question. Yes, we want to reassure you that our role as leaders at this table is directly connected to what we view as our national security and those interests. I talked about the executive board, and I'll continue to talk about the executive board because that governing body really does serve an important purpose in steering and guiding the work of WHO. There are 34 members, the U.S. is one. As I mentioned, China, Syria, Belarus are also members of that body. So what we do is we really take advantage of our seat at the table to ensure that our interests, whether they be in global health security, specifically in biosafety and biosecurity, or in other areas of public health, are well represented. We've had other members cycle on and off of the board as well, even in my time as alternate board member, including Russia. And you can imagine during that time, as we were deliberating as a board around how we respond in Ukraine, for example, in WHO's work in that space, how important U.S. leadership was, again, at that table. Finally, when it comes to the reforms that Ambassador Nkengasong mentioned, we've been very specific and deliberate with WHO about what we'd like to see. We really need to understand, for example, how they're allocating their funding and ensuring that funding is going towards programs that have a real impact. This might seem basic to us, but we have to remember WHO was a technical institution in its origination, in its origins, and over time it's had to become more management savvy. And so we as a U.S. government are really helping steer the organization in that direction, and again, having it operate at its highest and best use.
So thank you for that, Assistant Secretary. Mr. Ambassador, I'm going to go to you, and I'm going to ask you to build on that and ask you another question. The Biden administration has established the Bureau of Global Health Security and Diplomacy to lead the State Department's work on preventing, detecting, and responding to infectious disease. How has the Biden administration's efforts to integrate global health security across foreign policy through your Bureau advanced our national security interests? And knowing that you all work together, how do we make sure China doesn't lie to us the next time, which is what my colleagues on the other side and we are worried about? How do we not undermine people's confidence in WHO, but assure them that we are working and holding those countries accountable for telling us what's going on?
Thank you, Congresswoman, for that. There are three goals that are driving the new bureau that was launched, Secretary Blinken launched on August the 1st. One is to leverage all the assets that we have domestically and globally so that we can address the challenges of global health security as a whole. As you know, Congresswoman, through the program, the PEPFAR, the President's Emergency Plan for AIDS Relief, we have footprints in about 55 countries in the world. And we've built capacity in those countries, those assets and public health systems are being used in responding to other disease threats like COVID. It was very instrumental, especially in Africa, when COVID emerged, and we used that for rolling out testing, vaccinations, and other PPEs there. So by having such a footprint, we have diplomatic leverage in countries that we are operating. I mean, we have access to the leadership of those countries. We have professional allies, and we have control over what is going on in terms of having the right information through such platforms. Secondly, is really to coordinate. Coordinating. We've said severally during this hearing that and highlighted the importance of coordination. I think one of the things that the Bureau will do to advance our foreign policy through the lens of global health security is to coordinate everything, the assets that we have, both internally and externally. Lastly is to elevate the global health security as part of our foreign policy. During the COVID-19 pandemic, our Secretary of State, Secretary Blinken, established a platform called the Foreign Ministers Platform, which was very instrumental in reaching out other sectors of the society other than the ministries of health in our partner countries. And that platform was very useful in the way we discussed how vaccines will be distributed, in the way PPE were made available. So we want to build on those existing platforms and expand on it so that we have regular contacts with foreign ministries across the world to continue to promote global health security as a foreign policy.
Thank you, Mr. Ambassador. I yield back.